time out of your busy day to come talk to me. I know you have a very demanding job, and I know that you are a nurse coordinator here at BrightStar. Can you tell me about some of your responsibilities?
Yes, and thank you, Anna, for having me. Here at Bright Star, we have several core values. And one of our core values that I truly take to heart and strive to perfect every day is to serve with passion. As a nurse coordinator here, I've been here 2.5 years, and I am telling you, I absolutely love what I do. And I serve with passion every day. We have patients that are sometimes shut in, sometimes shut out, and they need us. They need us to be there to help them create a quality of life. So, as a nurse coordinator, I not only supervise the caregivers in the home, but I help the families bridge the transition of sickness into health with their loved ones or themselves. As a case coordinator, I, I advocate for my patient. I make sure that they have everything that they need to be or stay in their home or to live a quality life. I also join venture with several other health professionals to make sure that they have a holistic recovery. As a coordinator, I enjoy being able to teach the family, teach the caregiver, teach the patient, any and everything that they need, give them the tools that they're going to need to be able to be successful in the home and to be able to live in their home and to be able to thrive in their home, whether they're recovering from a surgery or whether they are recovering from sickness that has landed them in the hospital and now back home. So when I walk into the home as a care coordinator and as a case manager, I'm doing exactly what it says. I'm going to manage that care from start to finish and make sure that the caregiver knows exactly what they're supposed to do to give the highest quality of care. And at Bright Star, that's what we do. We give high quality of care.
So you think that's something that really makes BrightStar stand out for other agencies? And
Absolutely. I mean, think about it. Here we are. Some of my patients are 90 years old. I have one that's 101.
wow.
I have a couple, she's 96 and the patient is 101, and they are still in their home. And yes, absolutely. We 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 stand out because we have qualified caregivers, we have RNs, we have LPNs, we have CNA, certified nurse and assistants, and we have just caregivers, homemakers. And we provide care from A to Z, companion care, transportation. We provide nursing care, wound care. We provide hands on infusions, and we do med fills, and we do research with new drugs that are coming out with different pharmaceutical companies. We do flu clinics. We do nursing in the schools. We send out nurses to the schools. We do child care. We do special needs. And one of my duties here at Bright Star is not just to be a care manager, a case manager, but I also do staffing. I staff the IPU, which is an inpatient unit for hospice. I staff hospice cases. I go out and we joint venture with one of the colleges here, COD, and I do mentorship along with one of my other colleagues. So we do a variety, and it's very diverse what our jobs are here at Bright Star. Bright Star is the Cadillac of healthcare in the home and out of the home. We're awesome. We're
You
awesome.
definitely make it sound like BrightStar is where you need to be. And if you were to just choose one word to describe BrightStar, what would it be?
One word would be jet setting. We are the jet setters of healthcare. We are the leaders of healthcare in the home.
And if you were to pick one word to describe your job, what would it be?
Absolutely phenomenal because I work every skill as an RN that I have learned throughout my whole 28 years of nursing. And I'm not a young girl, but I have been able to use every skill, Anna, to do a job, to help someone, to help themselves. So, working here for the 2.5 years that I've been here at BrightStar, one word is absolutely phenomenal.
Ruth, during your busy schedule inside of the office and outside of the office, what do you do when you're actually in the office?
Oh my goodness, when we're here in the office, it is like being at home. We're a team here. Every staffing coordinator, patient coordinator, from the secretary, human resources, our director, our DON, we all work as a team. We have meetings and we discuss our cases to make them better, to see what we can do better. We scan and, of course, we do the infamous paperwork. So we do all of our electronic charts. We update our electronic charts. We do chart review. We also make several phone calls. I'm always on the phone trying to either call a doctor, calling occupational health, calling physical therapy, calling a family to advocate for the patient. So we do several things while we're here in the office. We have to make that time very fruitful. And that's where we try to piece all the puzzles together. From the information we gather in the field, we come into the office, we collaborate with one another or an outside professional to try to advocate for the patient to make sure the healthcare is being consistent.
And correct me if I'm wrong, but is this office the only one that has a particular Jerry? Can you explain what
Oh,
Jerry
we
is?
love Jerry. Jerry is our mannequin that we work with. We have a skills lab. And you asked me earlier what sets us apart from other agencies. And that is that we not only have a mentorship program here at BrightStar, but we also have a skills lab. All of our employees can come into the skills lab and work on any skill that they feel that they need a refresher or that they want to review or that they've never seen before. They can come in. We have all kinds of equipment such as a Hoyer lift. We have injection therapy. We have a bed, a hospital bed that houses Jerry. And Jerry, we can do a catheterization on Jerry. We can do wound care on Jerry. Jerry can be either Jerry, a man, or Jerry can be a woman. We make an occupational bed. We can do bed making. We can do a bath on Jerry. We also have in our skills lab central lines for our nurses to come in and practice how to do a pick dressing change or a central line flushing. We have needles. We have all kinds of equipment in our lab. And we have nurses here, such as myself, which I love to teach. With much skill, all of our nurses here can do training. So it's no excuse. Our employees can always come in, Anna, and work on their skill. We have dementia training here. We have dementia kits because we have a very big program. We're starting an infusion program here. So our RNs and LPNs are able to really work on a lot of nursing skill set aside from our CNAs and caregivers that can do home skill. We have wound care. So we have a great skills lab, and that's where Jerry stays.
So maybe you can teach me a thing or two on
Oh,
Jerry.
absolutely, absolutely. If you want to learn something on Jerry, we can do that.
Great. Thank you so much for
You're
your time.
welcome.
I know you're very busy, but I do appreciate the passion that you put into your work. It clearly shows.
I love what I do.
And it shows. And thank
I
you
really
for that
do.
dedication. I'm sure your patients appreciate that as well.
And they do. They really do.
Yeah.
And thank you for having me.
Of course. Thanks for watching.